This is the COVID-19 Healthcare Project.
My name is Buller Nojo Fatimi.
My name is Daniel Nguyen.
My name is Eugene Park.
My name is Faith Leonard.
My name is Jennifer Wankel.
My name is Jocelyn Vazenbaker.
My name is Kenneth Davis III.
My name is Sally Ashraf.
And my name is Tandu Chama.
So now I'm going to start by breaking down exactly who and what is COVID-19. So COVID-19 is an infectious illness that is in your respiratory system caused by SARS-CoV-2. Now you see all these abbreviations and you're wondering what they mean. I'm here for you. I'm here to break it down. CO in COVID-19 means corona. VI is virus. D stands for disease. And that all equals COVID-19. And the 19 stands for 2019 to when the virus arrives. SARS stands for severe acute respiratory syndrome coronavirus. Now I'm going to break down the definitions of asymptomatic versus symptomatic. Asymptomatic is basically an individual who does not have any symptoms or signs of sickness and does not mention them. Symptomatic is an individual displaying or telling symptoms. So this is one of many reasons why we have safety precautions in place, especially when we have people going to God knows where. This also, some people showcase they may have the virus and they may not show any symptoms, which can pose a risk to other people as well. So the best thing we can do is make sure we follow our protocols of washing our hands, staying our distance, and also putting on our masks.
Next is high-risk individuals. According to CDC guidance, the severity of illness from COVID-19 increases in correlation with age, especially with people age 65 and older. Individuals with certain underlying medical conditions such as heart, respiratory, or neurological diseases are also proven to be high-risk individuals as well. I also include some of the more severe conditions here on the screen as well.
Now I'm going to go into the origin and spread. So the virus was first identified in Wuhan, China, and based on research, the virus originated in an animal, and it is most likely a bat. And now I'm going to go to touch on the primary mode of transmission. So basically, it comes from a close touch from one person to another person. This is most likely why we have to stay 6 feet from one another and just keep our safety distance. The next thing I'm going to touch on is the causes of respiratory droplets to form with people cough, sneeze, sing, talk, or breathe. And this is one of many reasons why we wear a mask. These droplets can vary in size from large, some which are visible, to tiny, some of which are not visible. When small droplets dry rapidly in the airstream, they may form crystals.
This is a very condensed timeline of COVID-19 and what has happened since. So a few key dates that I like to mention is December 8th, 2019, the first patient who has been diagnosed with COVID-19, and that was in China. Next, we have January 7th, 2020. This was whenever COVID-19 was declared an actual virus. On January 20th, 2020, the first case in the US was reported for a 35-year-old man in Washington. And lastly, September 28th, 2020, the global death toll reaches 1 million.
So for the impacts of COVID-19, COVID-19 has majorly impacted so far us economically, politically, and religiously. For economics, COVID-19 has forced a lot of businesses to close, causing a lot of unemployment. For the businesses that did not close, they had a lot of reduced productivity, which in turn also hurt the economy. And COVID-19 has also hurt countries and businesses that rely heavily on tourism. For political, COVID-19 has caused a lot of lockdowns that has made people feel government control. The government had to choose health versus the economy. And there were rising concerns about information accuracy and large rises in partisanship. But overall, the political effects are largely unknown, and we'll have to wait until the future to really see. For religion, places of worship have been closed, but religious festivals and traditions still continue under strict guidelines. So for the methods of transmission, COVID-19 is really spread in two forms, which is direct spread and indirect spread. For direct spread, the virus spreads through droplets or liquid particles that flow from your mouth into the person's mouth, ears, nose, or other opening in their body. The virus also spreads more easily in closed areas and less easily in open areas.
For the indirect spread, the virus can remain on the surface for 2 to 3 days. It can also be transmitted by touching infected surface and also by airborne transmission.
Signs and symptoms: cough, difficulty of breathing, fever, headache, fatigue, loss of taste and smell are all signs and symptoms of COVID-19.
When talking about isolation versus quarantine, they mean slightly different things. Isolation means keeping sick people separate from those who are already healthy or any other person. This can be done by restricting yourself to your own home. If you're unable to do that, then you may need to go somewhere else to isolate yourself. In hospitals, for example, patients will have a separate space and have very limited contact with anyone else except healthcare workers who are wearing the appropriate masks, gloves, and gowns to keep them safe. Individuals who have been exposed should stay isolated for the duration of their infectiousness. Quarantine, on the other hand, means restricting the movement and contact of healthy people. So we isolate a case or we quarantine contacts, and they should be quarantined for 14 days. And this can be done through contact tracing.
So contact tracing is when it informs individuals on exposure and answering different questions about the disease. It's important for people to know about the symptoms and how deadly this disease can really be. It also lets individuals know the importance of self-quarantining. There are 4 types of contact tracing: workforce adaptations, which is who will do the contact tracing; epidemiological adaptations, which contacts who will be followed; system adaptations is how the contacts will be notified and monitored; and lastly, financial, logistical, and operational adaptations, which is what resources will be available for the system itself and how it supports it.
Infection and mortality rate. Worldwide, there has been 137 million cases, resulting in 2.1 million deaths. In the US, there has been 3.1 million cases. 562,000 have died as a result of that. 1 in 5 people are said to be infected in America.
There are 3 vaccines that are out in the U.S. that are available for anyone above the age of 16. Pfizer Moderna's 2-shot vaccine with 95% effectiveness. Johnson & Johnson is a single-dose vaccine with 65% effectiveness. However, Johnson & Johnson vaccine distribution is on a pause as of right now. And the COVID vaccine is an mRNA that makes spike protein, which triggers our immune system, which produces antibodies.
How COVID connects to UH. There are different measures that were put in place. A big measure includes social distancing. Classrooms, campus housing, dining, and common areas have been reconfigured to allow social distancing. Also, signs have been put out throughout campus at all elevators to remind students and professors to maintain at a 6 feet distance. Also, we have maximized online earning for social distancing to remove face-to-face for our protection. Also, important resources have been closed down. There's also free COVID testing on campus for all UH students. And also vaccinations have been provided for UH students. So go get vaccinated.